Hello again, this is Dr. John Hoy, physician and surgeon of the foot and ankle, practicing in the heart of downtown Seattle, Washington. Welcome to my treatment room. Today we will be talking about, are orthotics effective? Recently I have had some resistance from patients when it comes to custom orthotic therapy. One expressed to me that he would rather perform exercises to help his pronation, foot condition. He felt that orthotics would be a crutch. Occasionally, certain trends in medicine would arise. This seems to be another one. In the earlier part of this decade, minimalist shoes such as the Vibram Five Fingers were popular. Adherents believed that traditional shoes did not allow the foot to strengthen itself, and so shoes were a crutch. Subsequently, I had visits in my office from those who wore these minimalist shoes and sustained injuries such as metatarsal fractures. In our office, we do use custom functional foot orthotics a lot in the treatment of various foot conditions. Orthotics can be compared to eyeglasses. Eyeglasses change the orientation of the light rays that enter the eye in order to allow one to see better. Orthotics do the same thing by changing the orientation of the ground reactive force that hits the foot. Eyeglasses are corrective and do not change the eyes to make them see better. Orthotics work the same way. They are corrective but do not change the foot to make them walk better or without pain. Both eyeglasses and orthotics work only when they are worn. People who insist on performing certain exercises for the foot when an orthotic is indicated is like those who insist on squinting instead of wearing eyeglasses. Squinting puts strain on the muscles of the eye and is not as effective as eyeglasses to correct vision. Similarly, for many conditions of the foot and ankle, custom functional foot orthotics put the foot at the proper angle to walk. This angle is not easily replicated or sustained voluntarily. It is easy to regress into improper gait and allow the pathology to persist. Certain muscles then become overworked and then become fatigued or injured. Now, while orthotics are good for treating certain conditions, they are not a cure-all for all conditions. Patients should be cautious and may even want to try an over-the-counter orthotic with proper padding to see if it will help before committing to a custom device. In our office, we often describe this to our patients, what orthotics to wear and where to put the padding. Patients should seek an understanding of how and why the orthotic treatment will work for their condition. The following are some conditions for which custom functional foot orthotics are commonly prescribed in our office. The first condition is plantar fasciitis. This is a condition that involves stretching of a ligament on the bottom of the foot, in the arch, or in the heel, called the plantar fascia. Orthotics help to decrease this pressure. The next condition is posterior tibial tendinitis or dysfunction. This is the tendon that raises the arch. If there is pathology in this tendon, the orthotics will help the tendon to do its job without excessive effort. The next condition is a flat foot or pronated foot. There are many pathologies that can arise from this type of foot and can produce pain. Orthotics put the foot at the proper angle. Next, the high arched foot. There are also conditions that may occur from this type of foot. Orthotics will help support this type of foot. Next, bunions and hammertoes. These are certain contractures or deformities, and orthotics help these conditions from getting worse by correcting the underlying pathology. and will often help to decrease pain. Next, tarsal coalition. This is when certain bones in the back of the foot are connected during development. Orthotics will help limit the painful motion that the connections can produce. Next, arthritis. Orthotics will help limit painful motion here as well. Next, tarsal tunnel syndrome. This is like carpal tunnel syndrome, but in the ankle and foot. Orthotics will help put the foot at the proper angle to relax the tibial nerve. Another important point to remember regarding the efficacy of orthotics lies in the way that the orthotics are made. They should be properly made in a doctor of podiatric medicine's office and not at a specialty shoe store. It is incorrect to have functional custom devices made by stepping over a scanner or electronic plate or picking a number off the shelf. It is also incorrect to step into a foam box for a custom device. In order for the orthotic to be produced at the proper angle, the podiatrist must physically manipulate the foot and place it at the proper angle, called subtalar joint neutral mid-tarsal joint locked angle. The patient is usually seated supine and casted with plaster or a similar product. Less commonly, the patient is seated and the foot is manipulated into the proper angle while it is touching the ground. A 3D scanner may be used instead of the gold standard plaster. So for a custom device, not an accommodative device, but for a functional device, if no effort was made to put the foot into the right angle, the proper angle, the device will just replicate the pathological foot and will be limited in its usefulness. I am proud to have graduated from the California College of Podiatric Medicine. This is the school in which the science of orthotic therapy was invented. And I take pride in fabricating devices which many of my patients describe as life-changing. If you have a painful foot condition, please don't hesitate to call our office. And as always, take care and have a great day.